welcome everyone. I'm really excited to have you all here. My name is Alexis Plouffe, and I'm the founder and executive director of Truth Farm, which is an organization in Binghamton, New York. And what we want to talk about today is the fact that the CDC earlier this year announced that we've lost over 100,000 lives in the United States last year alone. And that is counting overdoses only. And something that we are really frustrated by is the fact that the government still isn't recognizing the total loss of human lives due to this epidemic. And mentioning some people that I know who have lost their lives, a young man from Windsor this year, his name was Trent Kennerup, lost his life to a blood infection. Hannah Dakota out in California a few years ago lost her life just because she fell asleep and couldn't roll over in her pillow. She didn't overdose. John Staples lost his life to hepatitis C years ago. And this year, our rainmaker Irene lost her life due to the effects of hepatitis C. And so we are losing people far greater than what the CDC is counting and reporting to American citizens. And we think that if now we come together and start memorializing and calling for action for all losses due to substance use related causes, we will finally find out the magnitude of this problem. The CDC declared overdoses an epidemic in 2011, but where has the governmental response been? We are given crumbs, pittance towards what needs to be done at the federal level. They give us crumbs and they use our loved ones' deaths to sue pharmaceutical companies to just fill their coffers, while our families bear the cost of funerals and raising grandchildren with no governmental support. That's our blood money. We want the government to have a proper response to this epidemic. And we have been really frustrated with the lack of action. We've been also frustrated by the fact that across this movement, or across what might not be much movement, is the fact that we have groups siloed and segmented. So we have folks from harm reduction, overdose awareness, anti-opioid groups, chronic pain groups, treatment, prevention, recovery, fentanyl poisoning groups, all doing work, but doing work independently. And we hope today that we are going to change that. Because if we come together and work across all of those silos together, building unity and force throughout the country, imagine what we can accomplish. And so today we want to make sure that people see we are unified across the country. We have over 70 partners involved in the project that we're about to tell you about. And we are boots on the ground folks. We are grieving families. We are individuals who suffer from substance use disorder. We are people in recovery. We are people who actively use substances. And we refuse to accept this as our nation's reality. A healthcare system that leaves our people to die. That ends today. I'm going to hand it off to my friend Susan Osterman to share.
Let's unmute here. Hello, everyone. My name is Susan Osterman, and I'm the president of Paloma Memorial Foundation in Bensalem, Pennsylvania. I started this organization to create memorial gardens nationwide to honor our children after I lost my son to an accidental overdose in October of 2020. I just want to talk a little bit about one of the failures that we encountered. On May 28th, 2020, my son Tyler turned 24 years old. It was during COVID, and not only could I not be with him, it was his birthday. So I had a small cake and candles delivered to the hospital where he was awaiting surgery for endocarditis. I was hopeful because I had just transferred him to one of the best hospitals in our country. See, he had heart valves. He needed heart valve surgery, and the previous hospital wasn't willing to do it. They were willing to let him die instead of doing a job that they're paid to do, only based on him being an IV drug user. But Tyler wasn't just a drug user. He was my son, and he deserved the chance to live a healthy life. I was confident in this hospital that they were going to be different. I thought they were going to give him the care he needed and deserved. It wasn't until a few weeks later when I was allowed to visit that I saw the candle and the cake sitting on the windowsill untouched. Tyler spent his last birthday on Earth alone in a hospital room. Just imagine what this does to a person who's already suffering. Imagine knowing that the people you rely on for your life to care for you don't even value your life enough to spend 5 minutes to share a birthday cake. This is unacceptable, and I now know that this isn't unique. It happens every day all over this country, and it has to stop. There's so many components to this crisis, and we have to work together. We are united on many things, and those things we have to embrace and come together and use our voices, because our voices matter and we have power. So I'm happy to join this initiative with Alexis and everyone else and move forward with the things that we do share and can agree on.
And I am honored, beyond honored, to be able to work by your side. And now I'd like Mary Beth Sahaki to share.
Hi, my name's Mary Beth Sahaki, and I'm the facilitator of Support After Addiction Death in Bear, Delaware. I started this support group after losing my son Matt in 2015, when I realized that there were hundreds of parents in Delaware who were also in my shoes, and we really had no support. I joined this national movement called the Trail of Truth because I feel that the truth must be told. The truth is, my son Matt, he did not have to die. The truth is, more doctors prescribe opioids than any other form of pain treatment. The truth is, the insurance industry has ignored parity for years. The truth is, the insurance industry continues to discriminate against those suffering from substance use disorder. The truth is, the insurance industry ignores all the scientific evidence that states inpatient treatment, in order to be successful, must be 60 to 90 days. The truth is, the treatment system is nothing more than numerous roadblocks preventing those in need of treatment from obtaining it. The truth is, the treatment system cares more about insurance reimbursement than saving lives. The truth is, stigma lives. The truth is, my son Matt suffered from a powerful brain disease. Matt died because after back surgery, he fell prey to pill-pushing doctors here in Delaware, hiding behind white coats, doing great harm while ignoring their oath to do no harm. The truth is, I'm so damn angry, I could scream every day of my life. The truth is, I will never stop fighting and speaking the truth until people like my son stop dying.
Thank you, Mary Beth. Thank you for speaking your truth. And that is exactly what we're going to do, is blaze a truth across the truth trail across the United States. And now I would like to ask my friend Lupe to speak.
My name is Lucas Salazar. I am the executive director of a nonprofit organization in Chimayo, New Mexico. I am representing our families from northern New Mexico, a rural community here in Chimayo. I started this grassroots organization 7 years ago, looking for support for my son. The more I learned, the more my heart hurt. It was not just my son, it was the sons, the daughters, the grandchildren. For decades, we have suffered silently due to the walls of stigma. Our loved ones have passed away, many of them all alone. Today, it is their face and our voice. Together, we can stomp out stigma, begin to heal, to make a better tomorrow. Please support our memorial walk and memorialize your loved one. Thank you.
Thank you, Lupe. And now I would like to ask my friend Marquita Edwards to speak.
Good morning, everyone. I am Marquita Edwards, the co-director of the Community Rising Project in Troy, New York, which I started after seeing all of the trauma and the pain in our communities in New York State and continue to suffer behind the systems and the safety net set to protect us. America has stigmatized us for far too long for every reason imaginable, whether you're short, tall, big or small, black or white. And every community across this country has lost someone for being stigmatized for substance use related deaths. It is time for this to stop. We cannot continue to allow our loved ones to die. We have to understand the truth behind stigmatization. And we have to let it be known in our country. We have to stop hiding, and we will not hide any longer. We will come forth, and we will speak the names of those we've lost. We will let it be known that their lives were not in vain. So I come today to let it be known that the time stops now. Not another person will die. Not another person will have to be alone. It's time for America to step up, and it's time that we go and let it be known who we love. Thank you.
Oh, I'm so honored. I constantly feel honored by the incredible people that I get to work alongside. Thank you all for speaking your truths, for letting people know what's going on, and for showing that we are not going to put up with it. I am just so honored by the strength in this space and in this room, and what this movement is going to do is going to be absolutely incredible. So I'm going to back up a little bit and tell you about an event that we host every year in Binghamton, New York. It's called the Trail of Truth, and it's our event that we host in honor of International Overdose Awareness Day. But what a lot of people don't know, we've held this event every single year, and this will be our 7th year that we're hosting it. What a lot of people don't know is how it started and why it started. It actually started in 2016. And at that time, we discovered, as a small community-based organization of just made up of only volunteers, we discovered that our county was not counting all of our loved ones when they were reporting overdose fatalities. And as the numbers were coming out, the county was releasing, we were just saying, this can't be right. Like, I knew myself several friends who had lost their children, and I knew that the numbers were not accurate. And so as the year continued in 2016, we met with the county, asked them to report overdose fatalities correctly. They pushed back. We naively thought that they would do the right thing. Instead, what we found was that they dug their heels in, and they were more defensive, and they tried to conceal the losses even more. And so as a small community group of volunteers, what we decided to do was ask family members to submit their loved ones to us. Share your loved ones with us, we said. Send us their pictures, send us the dates they had passed, tell us about your loved ones. And what we decided is we created an event called the Trail of Truth. We put all of those loved ones, each one on their own tombstone, their own picture, their information, loving things about them. And we created a memorial cemetery where families could come and grieve together. We had speakers educate attendees about how we could reduce the fatalities due to substance use. And then we had the family members pick up their loved ones' tombstones and march in power to our governmental plaza, where they put those tombstones against the governmental building. We laid down and had our bodies traced. We wrote the names of our loved ones in those tracings and beautiful things about our loved ones. And this was a strong message to our county saying, you cannot erase our loved ones. You must recognize this loss. You must see these people as individuals who matter to us. And now this event, after 7 years, has come to be something that these families count on every year. It's a place that families can come, they can heal, they can grieve together. They're with other people who understand their pain, who understand their suffering. And now it's a place where we can all come together, be angry together, and demand change together, and actually make change together. The end result of that first Trail of Truth in 2016 in Broome County, New York, was our county government was reporting that that year we had only lost 16 lives at that point that year. We conducted our event. We called for an accurate counting, and our district attorney paid attention, and he did an investigation. What he found was that at that time, we had actually lost 56 lives to overdose, almost 3 times as much as the county was actually counting. And we made that change. Since then, the county accurately reports and counts overdose fatalities, so our loved ones are no longer missed. And I'm going to hand it off to Jess.
Good afternoon. My name is Jessica Saman. I am the Trail of Truth project coordinator here at Truth Farm, located in Binghamton, New York. And I got involved with the organization about 5 years ago after losing my brother Jason to a fatal overdose. So today, I'm here to announce to you all that we are taking our local Trail of Truth National to Washington, D.C. on September 24th this year. We will have a National Memorial Cemetery from 11 a.m. to 8 p.m. We're going to have speakers and performances at 1 p.m. At 3:30, we will march to the Capitol, and at 4 p.m. conduct a live performance art piece. To date, we have received over 500 submissions for the National Memorial Cemetery. And we will continue to take those submissions right up until the day of the event. If you have lost an immediate family member, please be sure to submit them to us. And now we need you. We need everybody. Everyone who cares about this issue and who, like me, after losing my brother and many friends, are sick and tired of the deaths and losing our loved ones and are ready to make some change.
And now I would like to ask my friend Stephanie to speak.
Good afternoon, everybody. My name is Stephanie Almeida. I'm Executive Director of Smoky Mountain Harm Reduction in Western North Carolina. Unfortunately, this is my 20-something year of being involved with the opioid epidemic, and lost my brother 10 years ago and my other brother Jimmy last Halloween. So I am not naive to the losses. For some reason, the harder we work to save lives, the more of our loved ones pay the price with their lives. We ask for empathy, compassion, and treatment without judgment or discrimination in our medical systems. Yet when our loved ones arrive at the emergency room asking for help, they're sent home in a short time, often in withdrawal and in a lot of pain without any help. And in many instances, not even offered naloxone to prevent fatality when they have no choice but to continue to use to stop the pain. Or even worse, they're told they don't want it. Maybe they're not ready, or you're not serious enough yet. Come back when you are. It's time to stop the shame and remove all the barriers that prevent our loved ones from accessing the medical care that they deserve. Thank you.
Thank you so much, Stephanie. And Dinah, could you speak now, please?
Yes, hi everyone, and thank you for showing up today. What the Trail of Truth is really about is building relationships. And it is partnering with those who are like-minded, those who are not like-minded, those who want to know more, those who have lost loved ones, those who are afraid to lose loved ones. It's anybody and everyone who is just tired of the war on drugs and the war on people. We need to start forming relationships, nurturing relationships, and reaching out to those that we would never think of reaching out to different movements. Let's not think about the stigma and the hierarchy that has been embedded in us for years and years and years about drug use. Let's think about loving and showing compassion to one another, and forget about, calling people out of their names because they use drugs or judging people. Let's start really, really embracing our folks, and let's start showing them that we can actually stand united and we can do this together. Thank you.
Dinah. This all reminds me of a quote from a woman that I admire greatly, Loretta Ross. She says that many people moving together in the same direction with the same thought is a cult. Many people moving in the same direction with many different thoughts is a movement, and that's what we are building here. Now I'd like to show everyone that we actually are very excited to present that we do have a website for the Trail of Truth and for all these amazing partners that we've brought together. And I'm going to hand this off to Mia to share her story and the website.
Hi, my name is Mia. I'm the community arts liaison with Truth Farm. Sorry, I'm just looking to share my screen. I became involved with the organization after growing up in a household with older siblings who were affected by substance use disorder. And I am so excited to show you the website for the Trail of Truth that our graphic designer Sullivan and myself have been working on. So here is our homepage. Has a little bit about our mission, and right in the middle here, you can click to sign up for updates, which will direct you to sign up for our newsletter if you want to stay up to date. There is a countdown to the national event in Washington, D.C., which is so exciting. And then you can see here, there's a number of places that will direct you to submit a loved one to be memorialized, because that's really the most important part. So the form to submit a loved one is right in here. And there's also a form for groups to become a trailblazer. If you want to become in the organizational and labor side of the event in any capacity, you can sign up here. Again, the form is embedded. And then also, I'm so excited to show you all our partners page. So here are our core planning advisors involved in the organization of the event, our staff, Rainmakers, and our board, and then all of the participating organizations. And we are so proud and honored to have so many diverse organizations and individuals from so many different places joining us. And we're really excited to have this here as a place where we can highlight everything that they all have going on. So that is the website. We've been working so hard on it. I'm so excited to unveil it today. Oops. Sorry, trying to stop my share. That's it.
I was hoping the tears wouldn't come until this was all over. But I'm so grateful. I am so grateful for this army that we're building. I'm so grateful for every single one of you who are willing to put down what we don't agree on and focus on what we do agree on to make incredible change. And I want the world to know we are not going to stop until we make that change. We are not going to stop until actual action is taken, not these partial steps that we've seen over and over again from our government. We are not going to stop until our loved ones are recognized as human beings who deserve respect and dignity every time they seek care. The Trail of Truth is all of these people, all of the people that you see here, all of the people at home who've lost a loved one or have a loved one struggling or struggling themselves. The Trail of Truth are grassroots organizations, boots on the ground, directly impacted people, taking back our power, telling our stories and blazing a trail of bloody truth to Washington, D.C., where we will beautifully memorialize our loved ones to ensure that the government recognizes we will not stop until our loved ones have immediate access to treatment and an end to the discrimination in medical care. And so thank you all for being here today. I can't wait to see what we accomplish together. It's going to be massive. And I hope to see you all in Washington, D.C. on September 24th. And now we will take questions if there's any press present. I know that we had issues with the link and going live and all that, so I'm not sure if they're present, but if they are, we can take questions from the press. Did we let everybody in, Nick? Do you see anybody who looks like press? I know there were several.
Hi, how are you guys? My name is Emanuela Pierre with WBNG. My first question is pretty basic question. It's why have you guys decided to just expand outside of Broome County and going into Washington, D.C.?
We have, so Emanuela's question was, why have we decided to expand the Trail of Truth and go to Washington, D.C.? That is because the losses aren't just here at home. We see our friends suffering, we see other organizations suffering, we see the loss that is escalating across the United States every single day. And as I mentioned, not just overdose fatalities. We have fentanyl poisonings, we have overdoses, we have sepsis, we have endocarditis, we have hepatitis C. We have an endless list of ways that people are losing their lives. And if we were able to build this power and create change at home, why not build this power across the nation and take it to DC and make change where it really matters?
I would also like to add to that, of the 500 submissions that we have had to date, they are also from all over the country.
Any other questions?
Yes, I have one other question. Do you believe that, well, in your opinion, do you believe that after other organizations that are fighting for the same thing see you guys expanding and going outside of your county, outside of your state, do you believe other organizations will, you know, see this as an inspiration to do the same?
We do, and we really hope, one, that they'll join this movement. We have over 70 organizations, and we have probably another 30 organizations ready to get on board, which I'm blown away by. We just haven't had time to get them all on the website yet. So we will probably have over 100 partners by the end of this week. And, you know, I think that this could really be a method and a message to everyone working in movement spaces. I think for far too long, we as organizers have been only working in very narrow silos. And I think that some of them have become echo chambers. And I think in order to make broad scale change, we need to open our arms to different points of view, open our arms to organizations that don't always think exactly the way that we do, but care about the same issue. So it doesn't matter which silo or sector you're sitting in, I know that you don't want people to die. And so can't we focus together on what we do agree on and bring those singular focuses together and fight for change based on the things that we do agree on. I think that we can, and maybe other movements will start doing the same thing. I go back to that Loretta J. Ross quote again, you know, just thinking about that is absolutely accurate. Many people moving in the same direction with the same thought, a singular thought, is a cult. It's not a movement, it's a cult. Many people moving in the same direction with many different thoughts and many different ideas is a movement. And that's what we're creating here today.
Okay, my last question. I know you guys touched base and spoke about this a little bit, but just for me to ask it, by having this event, and just expanding again, what do you want people just nationwide to get from this? What is the most important thing that you want them to understand and see?
We have 4 primary goals for this event and for this movement, the Trail of Truth, for 2022. Our primary goals are to memorialize our loved ones in a beautiful and compelling way. It's not done enough. Their names aren't seen enough. Their faces aren't seen enough, and they are desperately missed by their families. And so we want to put faces to this issue. We want people to understand this isn't just a number. It's not just a number of people we're losing. It's individuals who were loved and cared for. And so we want our loved ones to be memorialized beautifully. That's the #1 goal of the Trail of Truth. The second goal is that we elevate this issue on the national platform to the government and to the media. And we have them recognize the scale of this loss, because as I mentioned, most people in the CDC are only reporting out overdose fatalities. They're not talking about the rest of the ways that we're losing loved ones. So we want to elevate this issue. The third goal of the Trail of Truth is to call for immediate access to treatment. Far too many of our loved ones ask for treatment and wait and wait and wait for it, or were denied treatment. As Susan said, her son Tyler was denied treatment. Too many of us have examples of our loved ones being denied treatment. Currently, the government is receiving millions and millions of dollars due to opioid settlements. They have the money. They have the money. The money is there. Don't let anyone tell you that there isn't enough funding and there isn't enough money to take care of our loved ones. There is. We are calling for immediate access to treatment. I don't care how they get it. I don't care how they get there, but that's what we're calling for. They have the money and they can do it. And then the fourth goal of this is to call for the end of discrimination in medical care practices. Our loved ones over and over again show up in emergency room departments after an overdose or in withdrawals, and they are treated horrifically. There is no standard across the United States that tells the hospitals how they are to be treated, and they are treated like garbage, like disposable people. We are calling for an end to that. And that's why we're coming together. And we believe that by unifying across all of these sectors, we are going to be able to impact change. And thank you, Emanuela, for being here and for your questions. Anyone else? If not, I just want to thank all of our partners for being here. I want to thank everyone who is following, for following. I hope that you'll go to the trailoftruth.org website and click to sign up for updates. I hope that you'll share your loved one with us. We will memorialize them in a beautiful way. I always remind people, my son is right there. He's right there with everyone else. And I'm going to memorialize your loved one as beautifully as I would memorialize my own son. And let's see all your faces in Washington, D.C. on September 24th. Let's carry those tombstones. Let's march to the governmental plazas in D.C. And let's speak in power and demand for immediate access to treatment and the end of discrimination in medical care. And let's do this all together. Thank you.